My name is Evita James. Healthcare 2030 will require leadership that is able to guide us through changes such as artificial intelligence and a growing aging population. For 2030, healthcare leaders will need to be confident as they guide their teams at the grassroots level to become accepting of responsibility and following through on commitments. These abilities for leaders will mean that they are goal oriented, they're able to build self confidence, and they're able to strengthen their internal motivation. They must also be willing to learn at every turn. Healthcare leadership will also depend heavily on their electronic human resource management to recruit a talented and skilled workforce, which is also technologically savvy. This is important because skilled workforce is key to organizational success, and this begins with recruitment. The emerging trends qualify cutting edge organizations as those that make investments in HR technology that allows their workforce to thrive. For example, these trends include specific platforms that allow for recruitment and talent acquisition that is streamlined from recruitment process, automating job posting, applicant tracking, and resume screening. Some platforms also allow employee onboarding and orientation, which can facilitate the onboarding process by providing new hires with access to digital orientation materials, training modules, and in essence, set up the workforce for success. Although emergent human resource technology has shown benefits, it can also lack inclusivity. For example, a skilled workforce who is not technologically savvy or but is qualified otherwise may not have strong technological skills. Therefore, to support a diverse, equitable, and inclusive workforce, HR platforms should include onboarding opportunities that help bridge the gap between workers who already have technology skills and qualified workers who need support building those skills. As mentioned before, the aging population will accentuate a healthcare shortage moving towards 2030, when the youngest baby boomer will turn 66 years old. Many state governments have already prepared by unlocking nurse practitioners and physician assistants, which are mid level providers, to perform independent work, not necessitating the co signing of a medical doctor for ambulatory care. But will this be enough? Do international medical doctors need credentials to provide telemedicine to patients in the US? How can these physicians be unlocked to provide telemedicine or even in person medical care without meeting the rigors of medical training of US physicians? While these questions are being sorted out, the World Health Organization has developed a code of conduct with the aim to protect poorer countries from deteriorating medical care because of richer countries recruiting their physicians. The Code of Ethics provides an important ethical framework to ensure that the international migration of health professionals is organized responsibly for both the countries of origin and the destination countries. For 2030, the goals of the Triple Aim will continue to have a seat at the table, and innovations will cater to patient centered demands fueled by AI. Higher education and medical schools specifically will incorporate the use of AI more broadly while finding innovative ways for learning process goals to be reached. I've mentioned some challenges before. However, items that are challenges today will likely be easily engineered by the use of AI in the future. For example, building capacity for access to affordable care could be increased by aligning international physicians willing to perform telemedicine for US patients. This alignment would be in terms of the evaluation intervention prescribed by an international physician could be analyzed by the use of AI and by parameters that lend validity to the intervention to the intervention, whether it is pharmaceutical or surgical. This system of care could decrease wait times for new visits and could decrease wait time for workup of symptoms by reaching a diagnosis sooner and hence a treatment plan. In this system, medical doctors and even primary care physicians could become consultants, and mid level and international physicians would be referring providers. By providing telemedicine, the international physician gains a better understanding of the U.S. medical system. Ethically, it allows for the international physician to continue work within their local community and is consistent with the Code of Ethics as presented by the World Health Organization. Thank you so much for your attention and looking forward to 2030.